All right. Well, thanks everyone for tolerating our technical difficulties. Welcome again to the Jameel Arts and Health Lab Arts and Health Conversation Series. I'm Nisha Sachnani, co-director of the lab. The mission of the lab is to measurably improve lives through the arts and advance access through policies that increase opportunities to engage in the arts and the arts therapies because of their known health benefits. And when we think about the arts and health, there are a number of different opportunities, different entry points, different concerns that arise that I know that many of you who've joined here today are working on. I will just offer to you here that this is a definition that we've been working with in the lab, and it's a definition very much in progress, but I'll speak to it here. The field of arts and health, referring to an ecosystem of practices and professions that use arts, culture, and creative expression to address specific health concerns and promote well-being across the lifespan. One of the reasons we've oriented ourselves to an ecosystem is rather than focusing on one particular set of practices or one particular profession or approach, we're trying to adopt a view that there are many relationships that exist between the arts and health. And when we think about mobilizing the arts as a health resource, we can think about this, of course, in everyday life, in community health, in clinical health, in public health strategies, in our schools, and other spaces of social engagement. One of the questions that comes up in this field is, how do we find out who's doing what? If we really are going to mobilize the arts as a health resource, how do we find out who is engaged in the arts and health in a particular chosen area, be it a city or country or region, and why does this matter? So we have 4 wonderful people with us today, colleagues who've been working with us in the lab. Maitri Gopalakrishna is the founding director of the Foundation for Arts and Health India, who will be speaking to how she has been going about this together with her colleagues from FAHI. And we have Dr. Michael Koon Boon, who's the Dean of Research and Knowledge Exchange at the University of the Arts in Singapore. Dr. Katie Warren, head of the PATHS Lab, which stands for Public Health Arts Theory and Sociology at the University of Edinburgh, also an affiliate researcher with the lab. And Dr. Ameer Shaheed, who's a consultant with WHO Europe, leading on a DG NEAR project examining opportunities to mobilize the arts as a health resource in Armenia, Azerbaijan, Georgia, Moldova, and Ukraine. Welcome to all of our wonderful speakers and to all of you who've joined us. I'm going to pass this on now to Dr. Michael Koon Boon to take us into the context in Singapore.
Thank you very much for the welcome, Nisha, and a very good evening and good afternoon to everybody. Hi, I'm Michael. I'm hailing all the way from Singapore. I've got 8 minutes. I'm going to breeze you through arts and health in Singapore. More information of my presentation today can actually be found on the paper that is published under the similar title, Connecting the Dots. And this is actually my sentiment of the landscape when I started arts and health. May I have the next slide, please? So for those of us who may not know where Singapore is, we are in Southeast Asia. We used to be a colony under the British Empire, and we got our independence in 1965. And since then, the country has progressed into the modern Singapore that you see in the image. So why arts and health? I think when I first got into this work, it is actually pretty much motivated by the aspiration of future-proofing in a way of thinking about what my society would be at that time when I turned 65 or when I retire, because I think there's a high prospect that I might land up in a nursing home. So as an artist, that's where my background is. That there was also a turn in the way I look at arts and think about art. So instead of just presenting art in a gallery, I start to interrogate what else a creative individual can actually do in society, particularly in community. So that was also when I stumbled upon the field of arts and health. Next slide, please. So I was asked today to just comment on how did I situate myself in the ecosystem of arts and health. And truly, I think that, as one began this work, we might start in a hospital, we might start in a nursing home, but through the conversations and the networking, that we go through in that journey, we would soon realize that it is just not an island. It's not just a hospital. We are also need to communicate with stakeholders such as the administrators in those spaces and perhaps policymakers as well as some colleagues from various fields ranging from the creative arts, the cultural sector, or even built environment, right? So and the field is actually emerging, and this is where the excitement is. So as I began this work, because of the short history of Singapore, I felt that it is important for me to get a sense of the land, to just understand where we are, how did we get here, who is doing what, and why are we doing this? So as the first step of the work, which is why I did this scoping study in terms of understanding the ecology to identify who the keynotes are for system change. And I use it very specifically in terms of identifying keynotes. And this is very intentional in my undertaking for arts and health advocacy in Singapore, because when I first started this work, I was a salesperson for arts and health. I actually knocked on all the hospitals' door, asking every hospital in Singapore, do you have an arts and health program? And we know how an acute care kind of setting is like. And of course, it was very hard to penetrate. Not saying that there were work. So this is why also coming back to the idea of the dots, right? So the dots in this conversation represent the bubbling kind of activities that is actually going on in the landscape. But how are people related? How are people connected? That's the puzzle that I was trying to kind of like put together. And I think it was also very intentional as I put this puzzle together. It is really to position Singapore to be able to interface with global counterparts, which, over the years, I think I've managed to achieve that, building on the paper on the state of arts and health development, because I think that's also for us to get a sense of where we are as a country in practicing arts and health, but also at the same time to be able to be where we are today, to be sitting in this moment, to meet counterparts from Scotland, from India, right, and even from Europe, just to have a conversation around that. And I think we are in a very exciting time. So to just delve a little bit down into some of the key findings, and just to give people an idea of how did we actually reach where we are today in Singapore, I think there are various circumstances that have led to that. Firstly, it is also because of the change in priorities in terms of the needs of the population. Like many countries, we are experiencing population aging, and then there's also that move towards a community-based care approach as a continuum of care. And then equally, as the landscapes evolve, we are not talking about arts and health then, there has also been policy evolutions of the arts, healthcare, and social care. So it's because of all this pivoting within the policy that also create that perfect ideal seeding ground for arts and health to sort of like took place. The language itself, the specificity, the specific use of arts and health sort of like came into salient probably also in the mid 2000, as I'm picking up this work, when I sort of like did a lot of visit back in Australia and then coming back in the early 2010s, just to connect with colleagues and started using that language more frequently, and that was also where arts and health became more prominent as a term in the landscape. And then how the arts then gets to start to be more integrated into the community as well as other sectors could also be attributed to the development of integrated care in Singapore. So this is an integration of health and social care, and it's true that pivoting that, through that different layering of work that actually happened in trying to join up the dots, that different sectors actually starts to come together to sync up. So as part of the effort, what the study sort of like review initially in that scoping paper was to sort of identify that visual arts is the most popular kind of art form. Work with seniors have also been popular, and a lot of work happen in hospital, but I can safely say that that landscape has changed very rapidly, at least in the past 5 to 10 years. And it's really very exciting now in Singapore to see that diversity in terms of, you know, the new generation of artists going beyond visual arts. So right now in the landscape, we have colleagues who are doing dance, we have colleagues that are doing applied theaters, we have colleagues who are also doing creative therapies and music. So I think there's more representation, and I think this help us to sort of like keep an eye on the who, the what, and the where. And talking about hospital, it's no longer just the only space where arts and health is sort of like being offered. So if you want to know more, you can actually scan the QR code to read more in the paper. But there are key findings in terms of that unevenness that still remains that we are trying to tease out. More need for intersectorial kind of support, as also, you know, looking into a pipeline of development for capability development as well as demonstrating impact. And out from this initial study, we have also established the Arts and Health repository. So if you wish to connect with us to signpost to this repository, feel free to also get in touch with myself or just visit the website and get in touch with us. So I'm just going to move on to the next slide just to give you an overview like where we are since then. So I call it the pulse of the field just to allow colleagues, you know, to get a sense of where we have landed today following that state of development paper. So there is a arts and mental health community of practice that was established in 2030. So I'm part of the COP, and this is really also to reach out to a variety of practitioners as well as colleagues from different sectors, from the arts, from social care, to actually come together to really imagine what this landscape will look like. And of course, continual effort from the National Arts Council to look into the relation between arts and wellness. So in last year's activation in Let's Connect, which is an event that also bring together cross-sectorial colleagues together to really then investigate, you know, what the arts could do for well-being. And this is actually a very useful kind of converging touch point. And more excitingly, I know social prescribing is a buzzword internationally. So we are also at the forefront of that. We have a social prescribing community of practice that is established by the Sing Health, which is a major health cluster in Singapore. And quite proudly in November last year, the Sing Health Community Hospital has been appointed the first collaborating center for social prescribing designated by the WHO. So I think that's quite remarkable. But like what I said, the ground is still very uneven. There's still a lot of work that needs to be done cross-sectorial wise, and we are working on that. And the bubbling kind of scenes that is happening right now, I think is also the focus on disability. There's already a step-up effort to look at disability in Singapore to create a more inclusive and diverse society, as well as representation to create equity in regards to access to the arts, as well as to address health equity. And lastly, working together with Jameel Arts and Health Lab, as well as our counterpart at NUS, Yong Siew Toh Conservatory, we are working on the Healing Arts Singapore, which is going to happen at the end of this year from the 8th to the 12th of December. So you're very welcome to Singapore. And on that note, I will stop.
Wonderful. Thank you so much, Michael. That's really wonderful. And I will just let this particular audience know that you're amongst the very first to hear that announcement of Healing Arts Singapore. And thank you so much, Michael, for sharing it. We're very excited about that. And in fact, Katie's going to be speaking a little bit about that in the context of Healing Arts Scotland and mapping efforts connected to that. But for now, we're going to pass it on to our dear colleague, Maitri Gopalakrishna, and colleagues joining her as well. Maitri, I know you've got your slides to share on your end.
Are you able to see my slides?
Yes, a little bit small, but yes.
Aha, let me try and fix that.
Maybe if you click present, that might take care of it.
Come on, friend, you can do this. Just gently speaking to my computer. There, is that better?
Yes.
Okay. Thank you very much. It's really nice to be here. It's 8 o'clock in India. I'm just, like Michael said, I feel like I have so little time, so I'm just going to push on and dispense with the pleasantries. So really our motivation was like, to really work towards this ecosystem of the arts and health in India. And very quickly to give you context, and this is like broad strokes context. So I apologize to all of my friends in India who know more and will miss the nuance. But here's where we are. There's a rich and varied arts practice. Most of our arts practices are woven into religious and community practices. And as a result, and also connected into that, the practice of art is also subject to social political hierarchies and stratifications like caste. And this is really important when you think about who has access to practicing what art forms and also what cultural spaces. There is an absence in many ways of mainstream institutional systems and structures through which the arts are being accessed as a health resource. And by this, I mean, for example, in many parts of the world, a discipline within the arts and health, which might be something like the creative arts therapies, have enjoyed, there are academic departments and master's programs that have been around for decades now. We don't have that infrastructure in the country yet. We're building towards it, but we're not quite there yet. We don't have an arts council, for example, through which systemically we're able to, make the arts and health be the arts be a health resource to individuals and communities. So these systems and structures don't exist. So as us at the Foundation for Arts and Health were looking around, we said, well, but that doesn't mean the practice is not happening, because the practice is happening. And we saw many examples of really exemplary practice in the intersection of the arts and health, especially in the context of community work and social justice. And there are historical reasons for this, but many of these organizations, I think someone, okay. And some of these organizations had been practicing sort of sustained and systematic work for several decades, right? So as we were looking at who is it that's doing really profound work, these community organizations became where we started out with our scoping. So we put together a team, and I'd like to invite Apeksha Vora and Pranesh S, if you're there, to quickly unmute and wave at everyone and say hello.
Hello.
Hi, Pranesh. Apeksha, if you're there, I'm not sure. But Apeksha and Pranesh were really the team that led this scoping effort. And we were interested in these questions. These organizations working in the community context, how are they bringing arts and health together? What are their approaches? What benefits do they see? And what are their challenges and needs? And I think the reason we did that was because we really felt like some kind of collective articulation needed to begin in the country. We wanted to share frameworks. We wanted to share expertise and resources towards field building and advocacy, knowing that this is an emerging field here as well. Also want to acknowledge this sort of catalyzing and supportive role of Alice Fox and Hannah McPherson. They are in the University of Brighton. They were interested to come to India and see whether there was possibility for collaboration. And they have experience working in the inclusive arts and public health. And they said, well, we want to come. We have a little bit of a dissemination grant, and we want to be able to look at what might be possible in the future. And we were able to then say, hey, we want to do the scoping, so let's be a bit opportunistic. And I guess we've had to work a bit like this because there is no institutional support really for us at the moment. So this is one of those, sort of jugaading that we did. And we were able to kind of make the scoping happen. So the method was quite simple. We created a long list through our networks. We did some purposive sampling from the list, and then we did some semi-structured interviews with organizations that were spread across the country, different regions, different geographies, different contexts. And then we said, hey, it would be great if we all came together So we organized something that we called Jalsa. Jalsa is a word that has many meanings in many Indian languages. In Urdu, it means social gathering. In Kannada, it means network. In Gujarati, it means carnival or celebration. And in the past, Jalsas have been political spaces where lok shahirs or people's poets performed their radical poetry, inciting in people's imagination the possibility of an anti-caste world. And so we felt like this word really captured what we wanted to do. And we invited 10 of these organizations to come to Bangalore, and we spent 2 days workshopping together. And so this was our spread. There were people all over the country, organizations working all over the country. Our first question, of course, is who else should have been here? And so we have these post-its of who else should have been here. So there's some snowballing happening already. We used our methodologies that we know well to go through these questions, these 5 questions, which are what are we seeking? What is our spread? How do we work, etc., etc.? What is the relationship in our organizations? What do the arts do? What do they bring that nothing else can? And going forward, what are our challenges and needs? And the other thing that we did, because we were really clear that we wanted to build an ecosystem, is that we created we had one open session and we invited key people. So we invited funders, potential other people that were sort of primed and interested, journalists, for this open session, because it was a window into the way we were already beginning to language and articulate together. So our key learnings from this one, the scoping and the gathering, is that we have these needs. There's a need to articulate existing knowledge and innovations. There's a wealth of existing knowledge. There's a need to critically examine existing categories, including the categories of things like theater, music, dance, which felt kind of alien on the ground. Nobody was practicing in those separate art forms, right? Everybody was practicing somewhere in the intersection of art forms. There was a need to demonstrate to others what people were able to see and feel and experience on the ground. There was this different ways that the arts were being used, sometimes as tools, sometimes as a way of knowing and articulating, and sometimes as a health behavior. The arts seem to challenge rigid health frameworks and create inclusive spaces, and community-based arts foster agency and engagement. So ways forward for this group, this was kind of exciting. On the last day, the group decided that they wanted to do a quarterly online skills sharing, because we learned that there were very different skills that the organizations had and had honed. So there were those that had sort of cracked the whole research, evidence-based model, health indicators, and so on. There was another organization that had sort of, was community arts organization. So they had cracked public engagement, right? So it seemed like it would be a really useful skills sharing, and we're going to start doing that very soon. There was a great impetus to write together, including things like an agenda setting, policy document, and so on. There was an impetus also to do Jalsa again, and this time another organization, not FAHI, but Agaz in Delhi, jumped up and said, we'll host Jalsa. And what that will do is it'll take it to another region, to another network, another ecosystem, and a whole bunch of other organizations will come together. So we're really excited to be able to support that. So ways forward for us at FAHI, we'd like to create an open source platform. So your repository, Michael, was an inspiration. We really hope to be able to create something similar and open source where people can kind of feed in to it, and where we can also create a platform for knowledge sharing. We also want to scope other contexts, for example, clinical contexts and mental health spaces, which we haven't quite done yet. And connect up to the kind of growing collectivization that's happening with the creative arts therapies, which is an exciting time also here. And then we also had this question about cultural asset mapping in a city like Bangalore. Is it useful for us at this time? Particularly because of how stratified arts and cultural spaces are. And does social prescribing make sense in our context? Is a question that we're sitting with right now. So just to close, Pranesh has this incredible ability of writing poetry after an experience. And so this is a poem that he wrote on the last day of Jalsa, and I'll let you read it.
Maitri?
Many, yes,
No, thank you. Thank you.
many. You want to say something, Pranesh? Go ahead.
No. It was just beautiful to have it. So thanks.
Yeah. Thank you for being here. Also, really want to acknowledge the contributing organizations and individuals, and of course, the whole party team and two amazing volunteers that we had. And we really did this on a shoestring budget, this whole thing in like $3,000 or something. So it was, yeah. And we're excited about how it's evolving. So thank you very much.
Thank you very much, Pranesh, Maitri, Apeksha, colleagues. Thank you so much. What a beautiful poem. All right, Tina, we see your note that it's hard to see the slides, and we're going to try again now with Katie Warren. Dr. Katie Warren, thank you so much for joining us. We're going to pass this over to you, and hopefully the slides will be visible for those who can't see them.
Hello, everyone. It's such a pleasure to be here today. Can I just check that you can see my slides?
Yes.
Nisha, can you confirm? Do they look big enough to you?
Yes.
Great. So yeah, my name is Katie Warren. I'm a researcher based at the University of Edinburgh, funded by the Leverhulme Trust, and I'm also an affiliate of the Jameel Arts Health Lab. I'm really delighted to be here today to talk you through some work that I conducted with Nisha and the Jameel Lab as part of Healing Arts Scotland last year. And in the first part of the presentation, I'll explain the context and the aims of the work, and then I'm going to share some key findings with you from our evaluation, followed by sharing some ongoing research that takes the form of a social network analysis. So starting with the context, the work was conducted as part of the evaluation of Healing Arts Scotland, as I mentioned. It was part of the Jameel Lab's Global Healing Arts Initiative, which was originally set up in 2020 as a response to the pandemic. HAS was actually the first countrywide activation spearheaded by Scottish Ballet in collaboration with the lab, and it took place between 19th to the 23rd of August as part of the Edinburgh International Festival. It included 376 events, including presentations, workshops, and arts activities, and we reached over 11,000 attendees. We also recently celebrated the launch of the HAS Impact Report in Scottish Parliament, which included some of our evaluation findings that I'll be sharing with you today. And I know we've got Nisha and Stephen and others from the lab on the call here, so if you have any questions about the Healing Arts Initiative, I'm sure there'll be time for that later. But before moving on, I wanted to note that some of our work was informed by a previous mapping of arts and health in Scotland, commissioned by Creative Scotland as part of the government here. And there's a link to that on the screen for your reference if you would like to follow up with that later. So we sought to meet three key aims. Firstly, exploring what is currently happening in arts and health in Scotland. Secondly, exploring what the priorities for the future of arts and health in Scotland are. And thirdly, to explore the network structure of HAS. So basically, we wanted to use HAS as a sample of people in Scotland to tell us more about the arts and health landscape. So it was sort of using HAS as a case study. And we were doing that in the context of exploring networks as well. Now, the first two of these aims were primarily embedded within a mixed methods evaluation that we conducted. And the third aim was part of a social network analysis that I'm going to say more about shortly. So two surveys were distributed as part of this work. One evaluation survey that went to all participants who signed up to attend an event at Healing Arts Scotland, and then one social network survey that was shared with people who were involved in organising HAS in some way. These tables show the combined demographics of people who completed one of these surveys. Now, as you can see, people were connected to arts and health in a range of ways, with over 40% noting they were someone who engaged in the arts to support their own health, and nearly 37% working for an arts or cultural organisation. Now, although the majority of people who answered the age question were in the 35 to 44 category, we had quite a broad range of ages. And then on the table on the right here shows that the majority of people identified as female, based in Scotland, and were white. Now, of course, this does suggest that we need to diversify audiences in future, but we also have to remember that this data only gives us a representation of the people who completed the survey and not everyone who attended. And unfortunately, there isn't time to delve into this more deeply, but hopefully it gives you a little bit of context to what I'll be sharing. So I'm going to do a real whistle-stop tour of a few key findings that I think are relevant to today's discussion, but please do read the full impact report in your own time by visiting the URL on the bottom of the screen here. So we asked people what the primary art forms that they engage with in their work were. So we found that dance and movement, music and visual arts, and crafts and designs were the most popular art forms, followed by theatre performance and then literary arts. Now, media and digital arts were the least engaged with. Looking to the right of the screen here, you can see that we asked people about the groups of people that they work with. And mental illness, mental health and well-being were the most commonly addressed groups, followed by community health and non-communicable diseases. And at the lower end of the list, fewer people reported working in women's health or LGBTQ+ health. Now, obviously, there are some nuances to this, but broadly, this does map onto quite a lot of the key policy areas in Scotland and the kind of research that's being conducted as well, which is quite interesting. So this knowledge supports with identifying areas for future investment and highlights areas that may need additional support. We also asked what participants felt were important priorities for the future, and unsurprisingly, the majority felt that increased funding was required, followed by the need for key strategies to be developed. And as a bit of a transition into the next section of the presentation, where we're going to be looking at networks, we also asked people about their opportunities to network at HAS. The majority ranked these opportunities as good, very good, or excellent, but some people felt opportunities were fair or poor. And this is quite interesting as it suggests that some people were able to derive a greater sense of belonging to HAS than others. And we're trying to unpack further why this may be in our social network analysis. But before saying more about this, I wanted to share a very short clip with you from our qualitative data, which shows how someone felt that HAS was a way to become integrated into the community.
So I felt a little bit out of the community, but I've made so many connections and really reinvigorated some of my understanding and my networks and my language, and I really do feel that it's been a really important event for me. Yes, I do have come away feeling as part of a community, an exciting community.
That theme of networking community clearly coming through very clearly there. So just going to move on to the social network analysis section, but wanted to briefly explain what this is, just in case any of you hadn't heard of this approach before. So it's an approach to analysing the structure of a network. It draws on relational sociology and it seeks to represent the relations between different nodes in a network in mathematical terms. So it uses visualizations to illustrate and explore network formation and outcomes. It's quite exciting in the context of arts and health when we start to think about what stakeholders are involved in the field. But the nodes in a network don't necessarily need to be people. And in our analysis, we were also key to map out key priorities being addressed in relation to geographic locations, leading to the first question on the screen here. We also did want to understand people in their networks, though, and relating to organisations, leading to questions 2 to 4, where we wanted to explore key players and organisations involved, people and organisations who were important to fostering that sense of community, and then looking at the structure of the social network itself. Now, the research is very much still ongoing and we're deep in analysis at the moment. We've got so much data, but I'm going to share with you just a few of our initial findings. So here's the themes by geography map that I mentioned. We mapped out each location and associated activities at Healing Arts Scotland and then coded the themes that were being addressed in these locations using the data to create this network diagram. So if you look at the screen, you can see that the size of the coloured nodes represents their degree centrality. So essentially, the larger the node, the more locations connected to that theme. So as you can see, social prescribing here as the largest node was the most popular theme addressed and had the most locations who were addressing it. This was followed by mental health and young people and so on. And if you look in the middle, you can see that Glasgow and Aberdeen were linked with all of these themes. But it's really important to note that this map doesn't tell us what we should be looking at in arts and health in Scotland at large, but rather what was addressed during HAS. It obviously gives us some indication of priorities, but it's a subsample. So it may again support with identifying where to target resources in the future and what themes to prioritise in future HAS events and support with decision making. This network map shows very similar information. I know it's a little bit overwhelming, but it basically maps out every single event using a number to anonymize it. These are all the events and activities that happened at HAS, and then it it codes them according to the themes rather than focusing on their geography. But what we see is that, again, social prescribing was the theme that was addressed by the majority of events, followed by mental health in young people, and so on. So moving on to our work with people, coming on to the final section, we sent out our social network survey to 229 people who were in some way connected to the organisation or delivery of HAS. So this was organisations, people who were facilitating workshops, people involved in delivery. 76 people completed the survey, and the demographic information that was shared is on the screen here. The majority were from some form of organisation, which was probably to be expected, given that we were reaching out to people who are involved in the delivery of HAS. And the other demographics follow the trends that we saw in the larger evaluation survey that I shared earlier. So again, another quite busy diagram here that I'll explain to you. So in the survey, we asked people to select from a list of all the people involved in organising or delivering HAS, the names of the people who they were connected to, and they could list up to 25 people. And this network diagram shows the data from that particular question where people were saying, who am I connected to? So each number represents a person who completed the survey, and the direction arrows show the people who they said that they were connected to. And once again, the nodes are sized according to their degree centrality. So the larger the nodes, the more connections that that individual has. Now, this is just a preliminary analysis, but what we're seeing here is what's called a core peripheral structure. So there's a kind of core group and then an outer group. And what this suggests is that there are a group of key players at the core of the HAS organizational group, with numbers such as 47, 3, 8, and 10 here being key individuals for information sharing, and they could potentially be seen as sort of like a turnkey in that network to open out opportunities. It may seem like a little bit abstract to look at an image like this, but it really can tell us quite a lot about the structure of what's going on at HAS and potentially reflect on the broader arts and health landscape. And we've got more data to be able to pad this out in the future as well. And it might help us to explain why some people were able to derive more of a sense of connection at HAS and others felt more on the periphery. And we've got a few interesting qualitative quotes that support this as well. Sadly, don't have time to delve into all of them, but we've got people here saying that they feel connected to a broader network, a broader movement, it opening up their eyes to a number of organisations in Scotland, and there being an opportunity to make connections at HAS. And this suggests that the network we're seeing may be able to provide opportunities to expand and grow people's networks. But we also see one person here on the bottom right here who says that they felt somewhat on the fringe, which is what we also saw in the diagram with a selection of people on the outside who were only connected to those one or two people in the central group. So it does reinforce that sort of preliminary hypothesis that there could be this kind of core peripheral structure to the group and that there may be key individuals who are facilitating this work. Now, as I noted, this is very much ongoing, so we don't have sort of concrete conclusions for you at this stage. But it's interesting to start to piece together these network findings and think about the scope of this work in Scotland. And we can share with you a few of what our next steps are going to be. So we'll be looking at the strength of ties between individual in the network, as well as creating what's called a two-mode network. We'll be able to map out the relationship between individuals and organisations in the HAS network. We'll then be able to think about what analysis may help us to further interpret these maps, such as coding based on their organisational connection and the demographic factors. And essentially what this will enable us to do is to try and explain why people are positioned in certain parts of the network. So we can explain why someone might be located based on these other factors. So basically watch this space for more to come, but I hope that's incited a bit of your curiosity for the work that we're doing. I'd like to just end by saying thank you so much to everyone involved in this work. There were just so many people involved in this research and evaluation. And Nisha and I and the Jameel Lab are so grateful to every person listed on the screen here. Thank you very much.
Thank you so much, Katie. That was wonderful. I'm going to go straight to you, Ameer, and to continue the story. There are so many wonderful things to talk about already, and I know you're going to add to that.
Thank you so much. And yes, I'm so glad that I'm going last because there's so many interesting things about what I've just heard, and my intervention in many ways is the least developed because we're just at the beginning of this journey, and so I really appreciate hearing from my colleagues in terms of how to weave our own narrative into this. So if I were to give this presentation, this mini presentation, a subtitle, I might call it something more like asset mapping as asset generation, because I think one of the key takeaways for us in this when you're trying to map something interdisciplinary in a very exploratory way in a space where these where the work that exists everywhere is still very much islands rather than archipelagos. The very act of trying to situate them on a map can be extremely generative. And so, yeah, I think that's kind of one of the main themes for me on this. So to provide a little bit of context, my name is Ameer Shaheed. I'm a consultant, as Nisha said, with the Jameel Arts and Health Lab and the WHO. It was my honor to also be involved in Healing Arts Scotland. And we are now embarking with the WHO on a project that has just started, which is due for a 2-year period to work on supporting resilience in Eastern Partnership countries, which is a term for a number of countries in Eastern Europe, which include the 5 that are on the screen: Azerbaijan, Armenia, Georgia, Moldova, and Ukraine. And it's quite exciting for us because this is, in many ways, very early forays in 5 countries that are quite different contextually, but all of which have a landscape that is, I think I could say, less developed in the formal sense than arts and health is in, for example, the United Kingdom or Scotland or even Singapore for that matter. We are conducting this the cultural component as part of a broader project, which is aiming to support the health workforce and mental health in these 5 countries. And with the support of the European Union, we have funding to include a culture and health component within this. So in the first instance, we are trying to focus our work on mental health and to make as many connections to the health workforce as possible. But we are also going to be opening it to the entire wide spectrum of work that that is encapsulated within arts and health. We are in the very first stage, which is the asset map. So the broad strategy is essentially to have 3 phases to this work. The first one being to have a rapidly put together asset map to give us a sense of existing activities and strong potential partnerships for future activities. And then the second part of that would be to, based on this asset map, to have workshops in country where we can do a combination of things, one of which would be just delving deeper into the space of arts and health. And so with some of our international experts, some of whom are on this call, give a little bit of background on the kind of work which is going on in different contexts, the kind of evaluation frameworks, the kind of research that exists out there, and then critically getting people together to gather around idea generation around what is possible in these countries. And then the third phase would be ideally in each one of these countries to identify viable projects that could then be piloted. And so it's interesting because there's parts of what were discussed in the previous conversations, I think that we'll be doing, but perhaps in different stages. And so we are currently in the very early processes of trying to identify a focal point or 2 in each one of these countries that could help lead the asset map. the way we would like to do this is with the support of an advisory board, a group of people in this landscape that we hope can sort of fill as many of the parts of the map of the islands as possible to sort of help us sort of group it together. And then following that, have a deeper review in the workshop. And so I think parts of what Maitri was sharing in terms of the Jalsa event would be probably something we would do in the second part of the so not actually in the formal part of the asset map, but more when we gather people together. So our current work plan is essentially to gather experts that can help actually put something together, followed by with the support of an advisory group. And so this is already generating lots of connections. We are finding ourselves calling people from creative desk offices who work with the EU, to UN organizations, to civil society organizations, to members of different branches of government, from the culture sector, from the health sector, from social work sectors. And just in describing our project, starting to garner a lot of interest, and already identifying some of the key topics, some of these islands, in terms of whether it's disability in one country, it'll be loneliness and isolation in another one, or mental health in young people. So this has been a very interesting process already, which is starting to help build this community of practice. Another interesting thing that we noticed was that it was more useful for us to have people from it was more necessary for us as WHO to have people from the culture sector lead the asset mapping itself, because they often had a much more granular knowledge of the different participants or the different kind of activities which are already taking place, many of which are linked to health, but that connection is not always made explicit. We found that we often needed to, in a couple of contexts, because it's so nascent as a field, we needed to have maybe 2 or 3 people working together to help bridge the health and the cultural sector. And so just thinking through what we're already doing, in some ways it's like a rapid review of what's taking place, where we cannot really rely on a desk review of any kind, because there's so little that exists on a Google search will yield very little. That interactive component is the most generative, and as Katie's map showed, a few key individuals can make an inordinate amount of impact. And so trying to identify those champions in different contexts has actually been one of the key sort of turning points for us in each one of these different contexts. And I think that then, in terms of what we haven't done yet, and I'd be happy, and I'd love to know what different people on our call today have to say about that, is in terms of formal methodologies to actually develop this further, whether it's a survey, whether it's a snowball technique that we would be using, what kind of focus group discussions should take place, or network analyses. This part hasn't been done yet, but the very initial act has already been extremely generative, and is really focused on just getting together some of these key players. I'll stop there. I think I've probably gone over time, but happy to pick this up more in the conversation. Thank you.
Wonderful. Thank you so much, Ameer, and thank you all to all of our speakers for laying out how you've been approaching asset mapping in your area, in your region. And I'm just going to lift up some of the topic areas that you've opened up, and then we're going to open it up for conversation and questions amongst those who've joined us here. So you've spoken about sharing strategies for discovering who sees themselves as being involved in the arts and health. You've talked about informal to formal approaches, making a list. Who do you know who's doing this work? Getting together. Jalsa is now the word of the day, might be the word of the month, might become the word of the year. You've spoken about the role of key individuals who, are champions for the arts and health, who see the value of mobilizing the arts as a health resource, and they might be nodes that are connected to many others. Maitri also lifted up, who's not here, and how in your process, it was also about saying, well, where are the gaps? In fact, that came up in a few presentations. You've talked about how when you do bring people together in one way or the other, formally or informally, there's an opportunity to ask, who are you working with? Where are you working? What are some of the priority areas that are coming up in what you're hearing, or also that you see as priority areas, health priority areas, or other priority areas when it comes to sustaining the work? You've spoken about different ways of observing the impact of arts and health interventions, even though that's not the focus exactly of our conversation today, that asset mapping can also lead to insights about how this work is having an impact. You've spoken a bit about the resources that are needed to sustain practitioners and organizations. And I want to lift up also Ameer's comment around, can asset mapping be an approach to asset generation? So the act of trying to bring people together can also illuminate and encourage other people to see themselves as part of this network. Certainly, we've seen that in our public engagement strategy, which we call Healing Arts. That's our public engagement campaign, which Katie spoke to, and which Michael spoke to as well, all right, so many things to open up this conversation with. I wonder, and I also offer this invitation to our speakers, you might have been hearing something from somebody else. We were quite intentional about also making this conversation an opportunity for the four of you to hear each other, because there may be things you want to ask about or have questions about or want to comment on. And in the meantime, we'll also invite our audience to put their questions and comments in the chat for the time being. Or to just come off mute. And if we end up speaking over each other, we'll solve it. I have faith that we will. Any comments so far? How did that land with folks? Does it resonate with where you are in the world and how you're thinking about the work you're doing and who else might be doing it? And Barbara just says, wow.
I mean, I'm happy to make a comment if nobody's jumping in yet. I'll give you a bit of thinking time whilst I make a comment. I think what you were saying there, Nisha, about doing this work, generating connections, feels really resonant with me. Obviously, that was the purpose of the Healing Arts campaign, was to build this work. But even through doing the research and evaluation, by asking people these questions, it's raised awareness, like, to what is arts and health? What's the language that I use to talk about my work? And in one of our qualitative interviews, someone specifically said that doing that interview was what helped them to make connections in arts and health. So that feels like such an interesting point of discussion for the future, to like, how can we actually capture that in our work, to explore like the connections that we've built and made through the doing of this work. And I was also interested to hear more about Michael's repository from a more practical sense of how he actually did that. So if there's any space at the end, I would love to hear more about that as well, like practically, like, because I think doing something like that in other countries would be really exciting.
I'd like to do a +1 on the repository question as well.
There's a +2. I see a few hands already, Michael. There's going to be a session on repositories in the future. So Tina, go for it. You're muted.
Sorry. A question for Ameer, if I may. Going into, I mean, obviously the 5 countries you're working in are all very different politically. I do a little bit of work in Ukraine, and I'm interested to hear what kind of reactions you're getting from people when you're going in, looking at a map of the assets that are available in a situation where people are in the middle of a war and deeply traumatized.
I'm actually really happy that you asked this. It was one of the points I wanted to make, was that along with bridging connections and all the things we were just that Katie was just discussing, I think cultural asset maps is also a political act. It can be. And whenever we work in this space of culture, it's actually yeah, it can be intensely political. We're still at such an early stage, Tina, that I can't give you my experience because we're still in the process of hiring people and having initial conversations. But from what I've understood, it resonates very well with people who are working in culture, in that they are already sharing countless examples of people who are working on trauma, on disability. Um, both the people who are working on the ground and decision makers are are receiving this very well, saying, please do continue this, please do build this. But what I'm also sensing is that there's a political charge to speaking about culture that one has to be quite careful of. So I know that, so I've understood that there've been, you know, movements amongst the youth and in social media that's sort of about reclaiming Ukrainian culture and what that means.
The whole post-colonial issue, yeah.
Exactly. And so there are strengths to that, but there's also links to far-right movements and to other things that one might want to be quite careful of going forward. And so I'm already just sensing that we're going to have to be extremely careful in terms of, after our exploration, being able to have a strong enough criteria of selection that's that sort of allows us to take a stance on whether we sort of provide more air or space to a given area or a given project than another. And there's already vying that I'm noticing between different regions who want to sort of be the ones to showcase that, well, we're the ones who are supporting this versus others, in a context where there's also a lot of resource challenges. Different people view this in ways that can sometimes be more opportunistic than others. Totally understandable. But again, there is a charge to this. It's different to other kinds of research that I've encountered in public health in that sense.
Thank you.
Terrific. I'm seeing a terrific question in the chat from Carlos about the impact of arts and health and whether the success is related to the activity of leading with aesthetics, construction of meaning, and doing the activity itself, or to the social activity, getting together with people. And would people carrying out these activities remotely by themselves see similar results? And there's so much packed into that question, isn't there? In terms of, you know, we engage in the arts I mean, I don't know about you, I sing in the shower sometimes. I engage in painting when I have time for it. I'll engage in creative expression in different ways that are fulfilling for me. And then I might also participate in, you know, a photography class, which yields its own benefits. And I've participated in drama therapy for my own personal development, and that will yield certain benefits as well. So that's a good question. I'm going to open that up to the audience and also to our speakers to respond to. And I'll also highlight the multimodal nature of the arts, that of course it can stimulate us socially, can facilitate social interaction. It can also stimulate us cognitively and physically. It can stimulate meaning making, imagination. It can get us moving if we're talking about dance, for example, but even the act of drawing is getting us moving. So it's not a simple answer to your question. There are many reasons why the arts are having the impact that they do, or can have the impact that they do. And there are certain frameworks that have really been well articulated to try to elaborate on that. Katie could speak to that further. I see Michael's got his hand up as well. An ingredients framework, a radiance framework, ways of thinking about what is the impact of the arts and how do we understand those relationships. I'll pass it over to you, Michael.
Thanks, Nisha. Just a comment to add on to the conversation. I think in this conversations around arts and health, one thing that really struck me, you know, as a practitioner as well as a researcher, my background training is in the creative arts. I think within this multidisciplinary field, it's also a question of does arts and health belongs to the sciences or it belongs to the arts. So as a practitioner, as a researcher, I feel that there's a need in this multidisciplinary field to find that balance, because I think sometimes when we talk about arts and health, it gets very sciencey. But then, of course, that on the other end, we can talk about arts and health where then we are also asking how then is the evidence demonstratable. So I think that that is also an existing kind of consideration that as contributors to the field, it is useful for us to think about. And I think in my practice, I'm also very mindful of the terms of the season. And I think, this is maybe where the reflexivity and the criticality comes in the contribution to the field. To really, for me, what I'm really interested is to also ask the question of the in-between. So I think this is also a response to Katie's interesting work of the social connection. I think building on top of the existing connection, I'm also curious about what are people's desire and what people feel that they need to be connected to, so that it's a dot that is not connected, but then how then do we make the dots connect better? And I think building on that question of that connection, I'm also very curious about how this mapping exercise could also maybe allow us to evaluate the distribution or the redistribution of resources and capacity or capability within the arts and health. I mean, we know that the field comprises of colleagues from the arts as well as colleagues from the sciences, but sometimes the artists may not have access to the more scientific kind of methodology. How then do we as a community are able to kind of try to support each other to resolve that, so that we come back into this equilibrium of arts and health, so that one area of practice doesn't sort of supersede the other. Yeah, so that's my comment and invitation for us to think about the network connection piece of work. Thank you.
Thank you very much, Michael. There's another question in the chat. What challenges have you all faced in creating your networks, getting mapping off the ground? How did you manage to move through those challenges? Would anyone like to speak to
I mean, I think one of the biggest challenges for us was that we were using so many different multi-methods to do this work, which I think is very important because we can triangulate lots of different kinds of data to get a richer picture. But by doing that, we were asking quite a lot of people. So when it came to the social network analysis survey, which is quite an in-depth methodology, people have to really spend time identifying who they know. I think people felt like that was quite a lot to give. So one of my learnings from this is to try and simplify the methodology around the social network analysis and to be really very clear on the aims of what you're seeking to do. So if this is something that you're trying to do in the future, I definitely think about the research burden on the participant and how much time that people have to give to this. But all in all, I think when you can get people on board with the research and the evaluation and the mapping and really build connections through this and have that bigger picture around a shared advocacy for building arts and health in a region, that's going to get people on board to be able to engage with this kind of work. But I'd say that's probably the main challenge that I experienced.
I think the challenge that we experienced was that we were working with very, very limited resources. And there's a huge amount of labor that goes into this type of work. And we were all deeply passionate about it, Apeksha and Pranesh and I and Asim, and we were really putting in a lot of time and a lot of effort that just could not be remunerated. And I think that's one of the challenges of being an organization that's not part of an academic institution or not part of a system where you're able to get grants so easily for work like this. And it's kind of formative work, right? So I think that was a big, big challenge for us. So we really helped, all the little pieces that we could put together, all the little donations that we could put together to make this happen was really helpful. We also recognize that the organizations and individuals that we wanted to bring together wouldn't have their funding, so we had to be able to subsidize or pay for their costs to come. So that was something. And I think the other big challenge is really this was a trust building exercise. This was an exercise of, hey, we're all in this together, and there's this sort of collective liberation that we're working towards. And I think that we have to recognize that that was the point of the exercise. And there are a lot of reasons why trust is eroded, or there is caution, the historical reasons from colonialism. And so we really we needed to take time to allow those things to work through those, so that we created actually a space for some authenticity to emerge. I mean, that was a stated goal, for Jalsa. So I think those were our challenges, and I think keeping those building those networks of trust is something we continue doing. So we're very careful about things like consent and asking many, many times and having long conversations and not taking quick decisions and taking collective decisions together and so on. So it takes time and it takes resources, but I think it's quite worthwhile doing.
Thank you, Maitri. Thank you, Katie, and certainly Michael and Ameer for your reflections so far. Michelle, I see your hand.
Hi, I'm Michelle Dubois. I'm out of Eureka Springs, Arkansas, so I'm in the US. So, hey, so my question really, I think, is geared towards Katie. So I work with a very specific community, women over 40 with fibromyalgia. And so my big advocacy is all about neuroaesthetics. So I'm always using environment, brain science, art, all of that as a combination in which to manage chronic pain. And I noticed that you did a study on, you were talking about digital, how digital didn't come out, the digital way of utilizing art in health didn't come out as well, and also women. And so I just was wondering maybe if you could touch on that a little bit more. I'm kind of playing with like digital junk journaling for women. And I'm also playing with like small mini like kits for women, which are physical kits like art kits and things like that, that have, a combination of sensory brain activity with arts as well. So I'm kind of curious as far as that study went.
I mean, it's quite a big question. I think there's not really conclusive evidence at the moment for, is a digital engagement worse or better than an in-person engagement? And there's actually quite a few studies that I could draw on to answer this question. But like Daisy Fancourt did a study was comparing like virtual modes to in-person modes with singing. I've been involved with a study where we did online dance classes. And we are seeing that when there are things in person, there are certain stronger ingredients, if we use that language that we were talking about earlier, that do lead to mechanisms that lead to health outcomes, because we're seeing that there's this kind of co-presence with one another. There's an emotional connection. There's all those kinds of things that you get from doing something that's more offline. But at the same time, we're also seeing that sometimes digital engagements can be more immersive. They help people to connect to themselves. And they can also, if it's an online program, then it's something that maybe people feel more relaxed about. They can turn their cameras off. They can have a different form of engagement. So it's really quite a complex mix of mechanisms based on a whole range of complex factors relating to personality and individual assets, the social environment, the connections that people know, whether do they know the people or not that they're engaging with? Are they alone? Are they with others? So there's a whole list of things I could go through from our active ingredients work where we mapped out so many of these different ingredients. But I think some of the core things that we do know is that choice is very important and autonomy is very important. So if in your intervention, the women who you're working with who are living with chronic pain, they're finding enjoyment over these digital interactions and they want to engage with them and they make a choice over what they engage with, we do know that that's very important to people's health and well-being. But as I said, it's a very big question that we could delve into at length. And unfortunately, I know we're very close at time here, but I'd be really happy to continue discussing if you wanted to send me an email.
That would be great. Do appreciate your feedback on that. I think that especially women in my niche, it's very difficult because you have women that don't want anything to do with tech, so it's too complicated, it's too much. And then you have other people who pain is so extreme that going physically to somewhere is an impossibility. So you're really dealing with two sides of, of the market, and it makes it difficult.
Yeah, we did find that in the Dance Connect study because we were working with people who are living with anxiety and that they preferred the online option because they didn't actually, with somebody living with social anxiety, the idea of going physically to a place was just too much. So I think definitely taking those considerations in with a specific health condition as to what might be most appropriate is important. But as I say, conscious of time, so we can continue another time. But thank you for the question. I enjoyed it.
Thank you.
Thank you, Michelle. And with that, I think we're going to bring this conversation to a close. I want to thank everybody who joined us today, and especially our speakers for preparing a story to share with us about how you've been setting about with your colleagues the process of discovering who's doing what in the arts and health, and what this may tell us as we move this work forward. Thank you all, and please join us again for our next conversation. You'll receive an email with some information about that, and you can also, of course, find out more by following our various channels on social media and by checking out our website, which is also in the chat. Thank you all.